All right, team, we are back for Albert Road General Practices webinar series. For topic number 2, we're going to take a deep dive on the management of soft tissue injuries. And yes, I did emphasize soft tissue injuries. We're not talking about bone fractures. They take a very, very, very different clinical pathway. We need to treat them completely differently. Really isn't my place to be talking about how we take care of those. That's best treated by medical professionals in an emergency department. So with that caveat out of the way, let's get back to soft tissue injuries. And let me start off by setting a scene. You've probably been told about acronym RICE when it comes to managing soft tissue injuries. We're all taught from a young age that the best way to take care of ourselves after an acute injury, and maybe we've become accustomed to it as we're getting older, we rest, we ice, we compress and elevate that specific body part. And we've all been there. We've all been playing sport, being out active on the weekend, doing whatever it is that we love doing. And we take a hit, a trip, a fall, a stumble, we get hurt. We're lying on the ground, we're in pain, it's all uncomfortable, we don't know what's going on. We're sitting there waiting for help. Well, hopefully we get taken off the field, found by someone to take care of us. Maybe a volunteer parent comes along and slaps that trusty ice pack on, gives you a pat on the back, tapes it all up, gets you comfortable, says you'll be right, you'll be back next week, don't even worry about it. But what if it's not that simple? What if we're actually leaving effective treatments out of the picture that may speed up returning to activity? What if we're taking actions that may actually delay our recovery? What if there's more to it? So with those questions now at the forefront of your mind, let's reflect on what is wrong with the RICE acronym. And firstly, it oversimplifies the management of injuries down to 4 short steps, which I don't really mind. It's actually pretty good. The duration of care and the resources available to first aid responders is pretty limited. So that really requires and demands quick and simple strategies. And the problem is that most injuries go through a predictable sequence of healing stages that aren't supported if we leave our injury management up to RICE alone. And we see the consequence of assuming that RICE is enough all the time. There's nothing worse than seeing someone in our practice who's frustrated from being benched for their favorite activities because an old injury won't go away. Even though they followed the RICE principle, we hear stories every week, all the time, about the good intentions, about all the injuries being shrugged off, walked off, just to rear up a couple of weeks later when finally you feel ready to go back. You've rested it enough, you've compressed it, elevated it, iced it, everything's starting to feel good, the pain's normalizing, you want to get back to training, but all of a sudden, not that easy. Pain comes back, doesn't feel right. Now, I'm not against self-management. I'm not at all. In fact, if you refer back to our last webinar, you'll know that we discussed and promoted self-management when it comes to musculoskeletal injuries. I'm a big fan of it. I think that plays a critical role, and I'd advocate all day long, every day, for self-control. It's my hope, really, that this webinar, if anything, might help one person optimize their injury recovery and hopefully get back to their loved activity as soon as possible, just through implementing a few extra little steps and thinking a little bit more deeply about what it is that they're doing for themselves. So secondly, RICE is specifically designed to control the inflammation that occurs during an acute injury and leaves out advice on how to care for yourself during the most important parts, the early stages of healing and the longer term healing processes that occur much later as we recover from that said injury. So for completeness, let me explain a little bit here. The inflammatory phase comes first and lasts for 2 to 3 days after we've hurt ourselves. And during that inflammatory phase, the body's focused on preventing further injury. It's preventing bleeding, it's cleaning up the injury site, it's cleaning up any damaged cells, it's trying to do what it can to just contain that event. Your window of opportunity to benefit from RICE lies in these first few hours. Really, it's not much of an opportunity. We haven't got much in the way of compelling evidence to give us confidence they're actually controlling inflammation in those sort of periods after a couple hours as well. And secondly, our early healing phase sees a shift from inflammatory process into reparative processes. The body's no longer in a cleanup mode, it's in building mode. We begin to fix those damaged tissues to create scabs and scars and attempt to get the body back to its original form. And finally, we transition from that repair into maturation, or maturing phase, where we shift from building to fine-tuning. And we're not so much focused on getting the raw materials down to the injury site like we are when we're repairing, as much as we are concerned about those materials functioning properly in a way that hopefully prevents us from repeated injury in the future, that makes that tissue as functional and strong and as original as possible. Unfortunately though, like you've seen in a scar, that's not really the case. The human body is not designed to fully replace those injured tissues. Hence, injury recurrence is very common, especially if a full recovery and rehab phase is not seen to completion. So back to my issues with preventing inflammation. So it's often our first aid is provided with casual recommendation as well to trial a course of anti-inflammatory medications to manage the pain. And once again, the problem here is that we really need to let the body take care of itself. And that means allowing natural acute inflammation, as these processes let the body know that more advanced repair and maturation phases are required. The chemical sequences and the signals that our body generates during those early phases really sets up a cascade. It sets up a waterfall of events that follow, each one in sequence, each one in its own time, and really requiring that last step before to get underway and to work properly and effectively. And lastly, there's a lack of recognition for the psychological factors that inevitably show up during injury. And we're all too familiar of probably all experienced the sharp drop in motivation that comes from being sidelined, or the worry that things won't get back to normal again. And these are completely natural, normal thoughts. But if left unchecked and unsupported, they can cause substantial delay in returning to meaningful activity. They can in fact lead to substantial anxiety and worry and depression and delay in getting back into many of our regular, normal daily activities. So let's get down to it. Our new acronym, instead of RICE, is hopefully going to be for you in the future: peace and love. It sounds a little lame, but with a phrase to sort of support that a little bit better and understand it a little bit better, we would use a phrase such as, immediately after the injury, do no harm and let peace guide you. So we'll break that down into two parts, putting emphasis on part one and part two. Part one is do no harm. Along with RICE, you may have heard of this one before, especially if you've done some sports science or anything like that in the past, studies at uni or school. Do no harm in this instance is generally accepted that we are going to avoid heat, alcohol, running, and massage. Basically, each of those points is to avoid doing further damage. We don't want to add further stress to the system as it's in that really early recovery phase. We're sort of talking 2 to 3 days, 48, 72 hours, where excessively running away with or applying an added amount of heat could in fact promote blood flow, which may increase bleeding. Alcohol as well, just with the stress that it adds on the body, the blood thinning that may occur, and then running with the use of those muscles, tendons, ligaments. We're just delaying the formation of blood clots and scar tissue. So let me move on from there, and we'll talk about peace. And in this stage, we're going to let peace guide you, which really going to break down into its component parts. So P is for protection. Like the old acronym RICE suggests, we do indeed want to restrict movement for a short period of time until we know what's going on. That minimises the risk of aggravating the injury further, as we just discussed with the do no harm, and delaying recovery. However, it takes into we want to take that in moderation, really, as structured rehab can lead to actually better outcomes than delayed rehab. In the context of soft tissues, we know, say for instance, when a sprinter pops a hammy, you do it, or you've done a calf, we may spend, that remainder of the day doing those early protective behaviours and actions with the RICE. We may spend the day on crutches, putting some ice on there in the first few hours, as we've said. And the evidence from there, the evidence really does support getting that same person probably the next day into structured physio rehab, because you're going to get a better outcome in the end. The next day for some may be a little aggressive, so take that in moderation. As you said, 24 to 48 hours, maybe even 3 days. Certainly getting into some form of active intervention is probably going to be quite beneficial. So I rambled there. Let me get into E for elevation. The RICE acronym again serves us really well. Elevating the injury helps to reduce excessive swelling. Although that's not strongly supported, there's still some benefit to gain here. Lifting the injured body part up above the heart can promote blood flow away from that injury or the peripheral site, bring that swelling away from the injury. That, though, can be a little tricky. It's something that in my clinical practice people really struggle with, and I've struggled with it myself in the past. Lifting your limb above your heart, which is the goal here, requires some thought and definitely some environmental setup. For your shoulder or your upper limb, you're going to have to get it quite high, and you're not going to probably want to sit in the office with your arm up here all day long. And certainly good luck to anyone who can get their leg or foot up above their heart. I would love to see people do that more often, but environmental constraints often mean that that's not going to be possible. Okay, A is for avoiding anti-inflammatories. Like we mentioned before, anti-inflammatory medication. Inflammation processes promote healing. We really don't want to block those actions. There's signals, the processes that could be detrimental to our recovery if we prevent them from occurring, especially when it comes to the really strong prescription stuff. As even some emerging evidence coming out of emergency departments that is showing when we manage acute low back pain with anti-inflammatories that we could actually have a promotion of chronicity. So we could actually make matters worse and make them persist for longer. So you really want to be using your medications judiciously. As I'm saying this, if you're having difficulty focusing at work, doing something that really has to happen, parenting, whatever important activity has to get done, and if that injury is really distracting you from being able to get that process over with, then it may be an appropriate moment to use some pharmacological assistance. Your GP, your physio, your pharmacist is probably going to be able to give you some really good advice there. Definitely pharmacists, I would rely on those guys just quickly and easily as you're buying, maybe topping up. They can give you some advice on how to use it, how long to use it for, especially with those anti-inflammatories can run havoc with your guts. Let me move on here. C is for compression, and it's the last time the RICE really gets it right here. We are compressing the injury site to limit the amount of swelling, and that has been shown to have some positive but not terribly strong effects on recovery. Compression is often more practical than elevation as well. You can wear tubey grip or compression garments underneath your normal clothing and no one's really going to notice. It won't fully prevent the gravitational flow of swelling down into your limb as they're going to be below the heart, but there is some benefit on the table. There's still some wins to be had there. Do you need to go out and buy some really expensive compression garments? Maybe not. Reducing swelling, though, can make the joints feel less swollen. That may be a sort of an inroad into resuming your physical activities or allow a speedier initiation of active exercise-based therapy. So if you've got it available to you, or if you can get some fairly cheap tubey grit from the chemist, it could be worth a try. Lastly here, we're going to talk about E. E is for education, and as therapists, really this is on us to ensure that you understand your injury and your recovery process. We should be leaning heavily on the best practice recommendations for musculoskeletal care that I've spoken about previously. That really sets you up for success. It minimizes unnecessary intervention. It helps to minimize or avoid the risk of surgery or having to go down that surgical pathway. And yeah, like I said, my previous webinar strongly supports this sort of peace and love management principle with the foundational recommendations from our last video. So check that out on our website, on our YouTube page, if you haven't already. Okay. So the second phase of peace and love is probably remembered with the phrase, after your days have passed, soft tissues need love. And that's really setting you up for success during rehab. And again, like I want to stress here that we're talking about soft tissues. We're talking muscles, tendons, ligaments. We're not talking about bones. So these stages, especially when we're going to talk about L for loading, it does not apply to fractures in their early immobilized phase. So L is for loading, as I said. Active approaches to rehab or exercise are consistently proving to be among the most advantageous forms of therapy, and likely and often more so than passive therapies. And your passive therapies being needling, cupping, massage tens, hot packs, ice packs, those sort of things that are done to you as opposed to done with you. Recovery of function really is intrinsic to active therapy. That's why I love it so much. You're healing by doing. You're getting out there and actually using that body part. You're trying to encourage the repair and encouraging the maturation in a functional way. Physios are really well suited to guide you through a supervised rehab process so that you can resume life as soon as possible in a way that gives you confidence that you're not going to be provoking that injury. You can monitor yourself. You can learn to progress yourself through a rehab program through exercises. You can watch for signs and symptoms that would suggest slowing down or speeding up. So active interventions really is what we're talking about with loading. So let me just stress that although I strongly advocate for exercise therapy, I also don't avoid or condemn passive manual therapies. I use them with my own practice. I use them on myself. Sometimes I find myself really, really wanting some of that as well because it does feel good. And if we can interrupt that pain process, we can perhaps get back to the active exercise interventions quicker. The trouble comes really though when we expect those interventions to do all the heavy lifting, pun intended, to do all the work and fix everything. Unfortunately, it isn't the best way and may actually be detrimental. As we said, do no harm, do no massage in the early phase to optimal recovery if we live in that passive world for too long or if we expect too much of it. So O next, O is for optimism. Setting optimistic expectations has been shown to play a really important role in achieving optimal outcomes. worry, movement avoidance, depression, anxiety, and just a few common psychological factors that creep in when injuries are poorly managed and may explain more of the severity and the persistence of symptoms than any other specific physical features. It's really interesting. It's a perfectly normal human behavior or experience to worry about our injury. In fact, after all, it's probably what likely prevents us from making the injury worse or going out there and doing something again. Using something when it's not ready to be used within certain parameters, and this is why you just get your injury checked out by a physio. They can tell you what's appropriate and what's not. But however, if worry becomes catastrophizing, or if fear becomes avoidance, we start to lose control of the process, and our symptoms are prone to worsening in both severity, frequency, basically in chronicity. Our minds and our bodies basically here, they don't exist in isolation. They work together to create the human being that you are. Your thoughts influence your feelings control your actions shape who you are. Our very essence is reliant on the synergy between our mind and our body. So I cannot stress this enough. It is something that goes back into our best practice recommendations as well, something I've spoken about in that webinar, and I'm definitely keen to talk about it in the future. Really keen to have some psychologists on board. We've got some great partnerships coming up with us and some local businesses in South Melbourne who are tremendous in the therapies that they can offer if those psychological elements are becoming a bit too dominating. Moving on, V is for vascularization. And that's just basically, it's just a weird way of saying that we don't want to neglect our base level cardiovascular fitness during the early rehab phases. You really can boost your motivation and increase tissue healing by simply staying active and finding simple, pain-free or minimally painful methods of maintaining as much fitness as you can. That may be as simple as walking or more engaging in more complex structured rehab. Either way, rehab is about really staying active despite your injury, finding ways to train your body around the injury, maintaining your strength and fitness whilst that healing occurs, if that is the relevant component. I'll go back to, again, the best practice webinar to say that we remember our tissues and our pain, the tissue quality and the experience of pain are not strongly related. So just because we're in pain does not mean that we've done some sort of damage, even though I've sort of set up a lot of the talk so far to kind of be in line with that. I guess that really does just further emphasize the weaknesses of rice and the strength of peace and love, because it gets away from the emphasis really in a matter of ways, many ways, it's away from the emphasis on the severity of the tissue damage. Now, lastly, we're going to E, and that is E for exercise. Perhaps the strongest evidence that we have here is for the use of exercise in the recovery of function following soft tissue injury. There's so many systemic and local benefits to physical exercise, I really can't begin to list them all. Generally speaking, though, exercise is great for overall mobility, strength, body awareness, mental well-being, general wellness, and overall fitness. So staying on top of those functions helps us to recover faster, gets us back into those meaningful activities sooner, because we haven't dropped so far away from what our pre-injury level was. So as always, your medical professionals are the best people to advise on what each of these recommendations mean for you. Physio is perfectly suited to optimally manage your soft tissue injuries, and the physios here hopefully are also really good at, very experienced at managing those soft tissue injuries. Really ought to know, I've done many myself. I could list off a whole range. Strained muscles, sprained ligaments, aggravated tendons, dislocated joints, broken bones, done the whole lot. And hopefully, again, the previous webinar that I did sort of speaks to the importance and the value that I put on base level care, base level recommendations for setting you up for future success. I really do wish that I had this advice years and years ago, as when I was much younger and much more risk-taking, and not so much thinking about my future preservation. But I'm really glad that I know what I do now, because as I grow and continue to place my body under physical stress with the activity and the sports that I love, inevitably I get injuries, I get hurt, and I know how to manage them. This is what I do for myself. But of course your results may vary, and of course it is best managed by a physical health specialist or a physical therapist of your preference. So if you need, if you're like me and you need that little bit of support, definitely I've got your back and know how to take care of these soft tissue injuries. And with all of that said, I just wish you to take care, and remember that when it comes to soft tissue injuries, we want to do no harm, and we want to let peace and love guide us in our recovery. So thank you so much for staying with me to the end there. I know I get a little rambly, but these are topics that are truly important to me, and I think there's a lot of value in spreading these messages and hopefully improving the treatment of people's musculoskeletal injuries, pain complaints, whatever it is that that's going on. Especially those local to the community who I might have the good fortune of bumping into. Please let me know if you're finding benefit from these. Share the video with your friends. Let them know about the best way to take care of themselves. And we'll catch you in our next series. All the best. Take care.